your Neurodive Corner. I know that I've been away for quite a long time and I've been neglecting you guys, but hopefully we're gonna start picking up again our series of videos about neurodivergent people and the amazing people that care for them. However, today we're gonna talk a little bit about healthcare and the threat in this country. Now, I know everybody right now we're all shell shocked. There's just way too much happening at the same time, too many horrible things in too many fronts, all at the same time. And that is hard. It's hard to cope, it's hard to stay engaged, it's hard to stay motivated and organized. But what's really worrying me, like although the National Guard and the military are occupying cities, ICE kidnapping people is horrible, the economy is going down the drain very quickly. All of that is happening and it's horrible. But what really is worrying me is healthcare. I mean, we have two extremely dangerous and incompetent people managing the healthcare infrastructure of this country. And the problem is, a lot of us don't know much about healthcare and the infrastructure and how it works. And although our system is very broken and it's a sick model, it's the only one we have. And it's about to get worse. The first time around, we still had the scientists and the infrastructure in place. They were still adults in the room. And that's why we kind of made it through COVID. Although the response was abysmal and it boils my blood that nobody talks about the over million lives that we lost. Like, we are always enraged about something in this country. And I always go back to 9/11. We lost a little over 3,000 people. And to this day, we all say we will never forget. And I'm not minimizing that because any life that's lost is sad. But how can we be so narrow minded and so racist where 9/11 we were enraged because it was people of color that cost those lives? But COVID, no, that's a little bit different. So that boils my blood. But right now, we are definitely in way more danger than COVID. You have Florida that already took the step of getting rid of vaccine mandates. That is incredibly dangerous. 50% of children in this country receive their vaccines through the VCF program, the Vaccines for Children program. If the Department of Health and Human Services changes the directives and say that vaccines will now be optional or they're not mandated or you need a prescription, we are going to have so many children unprotected, getting sick, getting other people sick. Think about that. Like, would you like to send your kid to a school where half of the students are not protected? Hi, Yuzu. Thank you for joining the live. I appreciate that. Thank you, Omu. Oh, I know I'm butchering your names, but thank you so much for joining the live. I appreciate each and every one of you guys. And if you guys can share and spread the message, even better. Hi, Jasmine. Hi. Thank you for joining. So yeah, so like I was saying, the vaccine issue, it's very serious. We had eradicated a lot of these pathogens, a lot of these nasty illnesses in this country, and now we're just walking backwards. And it's sad because none of us know what it is to see a child suffer polio and need an iron lung, or see a child die from measles, or elderly people get super sick with things like chickenpox and shingles and measles, all of that. And God forbid, if we get a pathogen right now, that a virus or bacteria that we do not recognize, this country is not ready. Never mind for a pandemic. Right now, this country is not ready for normal outbreaks. Never mind a full blown pandemic. And again, like these two clowns are such a big threat to this country right now. He is out there saying that SSRIs cause violence. Do you know how dangerous that is? Yes, antidepressant medications and SSRIs have a black box warning. Yes, suicidal ideation and homicidal ideation are rare side effects of the use of SSRIs. However, SSRIs save many, many lives daily. You know how dangerous it is to put out there that mass shootings are occurring because of SSRIs? You're going to have patients that are going to stop their medication thinking it's going to make them violent and then really get sick. And trust me, it's not the antidepressants, it is the poverty, it is the lack of jobs, it is the lack of affordable housing, it is the lack of health care. All of that. Everybody in the globe uses antidepressants and SSRIs. The whole mass shooting situation, that is a uniquely American problem because this country has a freaking fixation with weapons. They treat them like they treat their cocks. They would rather have guns than save children. That's the bottom line, full stop. Let's not try to make excuses because there is a way to be a responsible gun owner and there are common sense gun laws. Other countries have them efficiently working and don't have this problem. So again, we really need to push for the healthcare infrastructure in this country. This is dangerous, people. We're getting ready to go into flu season, RSV season, COVID, all of that. We need to do something. We need to work within our communities, within our counties, and get close to community clinics, get friendly with the physicians in the area if they have medical associations, because that's going to be the only way we're going to get the true information, and that's the only way we're going to stay safe through this hell. So just keep it in mind, you guys. Thank you so much to Carrie, Luna the lesbian. I love that. They, hey, LGBTQI community here. Shout out to all my LGBTQI people out there. Proud by here. Love my transgender people. We're gonna make an episode about that as well. Carrie, thank you so much for your comments. Luna, thank you so much for your comments. Thank you for joining the live. Please share, spread the word. We're just trying to build community and trying to get ourselves through this crisis. That's the only way we're gonna do it is if we lift each other and we operate from a place of empathy, education, nurturing. That's the way to do it. Yeah. Anyway, that's all I have for you guys tonight. Thank you so much, Neurodivers. Shout out in the comments. Let me know what topics you want to discuss. What else do you want to hear from me? Do you want to see more of the funny videos and shorts, or do you want to see more informational videos? Just let me know. As always, stay safe, stay healthy, lift each other. We're going to get through this. Love you guys.